Healthcare assistants support nurses and care for people in private homes, hospitals, general practices, or rest homes. On this video, I talked to Elaine Medillo, a healthcare assistant in a rest home in New Zealand. Please tell us about your New Zealand journey.
I'm Elaine Medillo. I've been here in New Zealand for 4 years, and I'm a healthcare assistant, or other known as a caregiver, in a dementia unit for aged care. I'm based in Christchurch, New Zealand. Yeah, it was because of my husband actually. Sa Pinas naman nun, though I graduated from nursing and I'm also a registered nurse there, but I wasn't able to practice it clinically kasi masyado na ako na-engage in a call center, BPO environment. And yeah, until I met my husband and the opportunity for him to go here. So in that time, may baby na rin kami. And napunta siya dito, in-apply niya ako as partnership, which is very lucky naman for me kasi hindi na ganun kahirap yung pinagdaanan ko. So, and yung time na he's a builder, mabilis na lang yung process. Yeah, in partnership together with my eldest. First day pa lang naman baby namin. Yeah. So, yeah, nakapunta kami dito in 2016. Hindi na kami kinailangan ng mga advisors kasi usually na-provide naman namin yung mga evidence ng relationship namin. Yeah. Tsaka in that time, malaking points talaga ng builders.
What is it like looking for a job in New Zealand?
Yeah. Target ko talaga is night shift kasi nga my husband works morning and may kasama na akong 2-year-old na anak. Usually, actually si Shen. So, kilala na ng mga viewers mo si Shen. Siya yung nag-help na saan yung mga tools, yung mga job search, paano gumawa ng cover letter kasi anong cover letter? Wala naman sa atin nun, di ba? Kasi siya ng mga sample. So yun, tapos nagpasa-pasa ako, pero ang target na kasi ang dami ko nakikita kung ano yung pasok sa field ko. It's either, yun nga, mga sa medical field, kung saan man, for sure hindi nurse, dahil di pa naman naka-register dito. Or sa about call center, customer service. Ayun. Pero siguro mga 2 to 3 na online application na na-decline ako. So medyo heartbreaking siya. Pero yung time ako yung post dito sa current na work ko na malapit lang sa bahay, few blocks away lang sa bahay namin noon ng rent. Tapos yung night shift din yung kailangan nila. So nag-walk-in ako. And nakakakuha kagad ako ng permanent post for night shift. And lang, siguro may nursing background ako.
What is it like working as a healthcare assistant?
From office works, di ba, na aircon. Lagi akong yung outfit mo, yung makeup mo, yeah. Pag dito night shift naman, tapos, pagdating pala, hindi lang siya expectation ko, more on mag-aalaga ka lang, magbabantay-bantay. Pero mas madami pa pala siya, halo-halong task. May cleaning pa pala, nag-vacuum. So may cleaning, may time pa ng pagpasok ko, kami ng mga veggies para sa mga chef the next day. So kakat na ipipil yung potatoes, ilang 1 to 2 sacks of potato, na feeling ko sa Princess Sarah ko.
Miss Nixie, handa na po mga patatas.
Ayun, kasi alam mo ito, rangin parang medyo, ano ba to? Ito ba yun? Abroad pa mo.
Sabi nila snow, bakit may potato?
Tapos yun yung mga part na, at first na, parang sabi ko hindi, this is, dollar to, and this would help my family. So, laban lang. Andito na yung work na nakaharap sa akin for now. So, why not just make the best out of it? At first, siguro first few months, yung talagang i-adapt yung accent nila para maintindihan mo sila. Kasi, yun nga, minsan din ako yung mga challenge. And yun nga, dementia pa. Yung mga behavior nila. So, yun yung medyo talagang, yung big part ng adjustment, yung behavior ng dementia patient. So, talagang, it will test your patience.
Tapos ano yung patient and staff allocation if you don't mind me asking? So for isang caregiver, ilang pasyente yung parang assigned sa'yo?
Yeah, sa night shift, sa facility kasi sa namin, is a rest home. So wala siya, hindi siya katid ng hospital level. So dalawa lang kaming night staff. And we have 40 residents. So 1:20. And medyo sad part is wala kaming nurse, physical nurse doon. Meron naman on-call. Pero yun, talaga. So, sa'yo mga emergency muna, first aid. Ikaw yung So yun nga, 1:20 ang ratio namin sa night.
If you are enjoying watching this video, please don't forget to hit like and subscribe. Salamat po! How much do you earn as a healthcare assistant?
Nung nag-start ako ng minimum lang yung payment, around $15 per hour. Tapos naging medcom ako, parang konting train lang about medicine.
Okay.
Yeah, which yung nagulat din ako na dito halos prepared na talaga na for nurses, di ba? Sa pharmacy lahat na nakapack. Hindi katulad sa atin, mga duty ko rin talagang iisa-isahin mo mga gamot na dito naka-ready na lahat. So yun, nung medcom ako pero may 0.80 cents ata na increase. kala ko naka-medcom na. Tuwan-tuwa pa ako. So nag-start ako ng gano'n. Tapos thankful dun sa mga union na talagang nag-fight na ma-increase ng caregivers. So by 2017 or 18, na-pass yung bill. So na-increasean kami from minimum to 19 na ang starting ng caregivers. Yeah.
Starting? Wow! That's cool!
Plus, etong career 4, sila yung parang nagre-regulate ng mga studies, yung mga leveling. Kasi dito, hindi pa ako actually ganun ka-familiar. Ano bang mga level 1, level 2? Yung naka-base, di ba, yung anong level yung educational attainment more some sort of stuff. Yeah. So, thankfully, meron nun at first na 5 countries kung registered nurse ka or may nurse, I think registered or nursing background ka from these 5 countries which include ang Philippines, automatically level 3 ka. Yung level 1, yung starting kasi ng 19 is level 1. I think something like that. Otherwise, mag-aaral ka ng mga modules may bibigay or para you go to the next level. So yan, dahil nga may background ako, nag-jump ako agad for level 3. So, na-increasean ulit yung salary ko. Then, meron namang isa pa doon na option for you to go level 4. Doon nga sa may mga international qualification. You just need to study like Maori or Foundation of Nursing of Maori. Something. Dito. Para makapag-level 4 ka. Or kung yung mga nag-study dito, may mga certain na course na in-acknowledge na magiging automatic level 4 ka. So, but it takes me a while kasi hindi ganun naging ka-supportive ko yung company ko noon. Parang madami pang naging kung paano ba ako pumunta. Akala kasi sa kanila manggagaling. Though may isang angel din na Pinoy na nag-agency na naka-duty ko, no? Na nagturo sa akin na kung paano yung online course din lang na free.
Okay.
Na Foundation of Maori. Sorry, I forgot the full title. So yun, i-take mo lang siya in my assessment, tapos at the end, may certificate ka. So yun, sabi niya, ipakita mo lang, send mo sa manager mo or sa boss. And yun, after a week, yun, na-achieve ko ulit yung level 4 na pay increase.
Wow! Okay.
In fairness, okay na siya. Competitive na yung Kasi
So,
right now,
how much siya bale?
kaya mga nasa range ng 23 to 25.
What's your advice for anyone wanting to apply as a healthcare assistant?
Yung mga dito, una, takot silang makipag-communicate. Yun yung mga usually na observe ko. So, just continue learning. And hindi naman important dito, hindi sila after sa grammar mo or sa, wag nating baunin yung mga discrimination na naranasan natin sa Pilipinas dahil sa mga, as long as you try to express yourself, so yun na, try to be more, at hindi confident na confident. Just try to express yourself the way you can. It's okay, no matter if it's grammatically correct or what. So, and try na nakaka-dishearten at first pag may mga nagre-reject sa'yo. But sabi nga nila is dun ka matututo sa mga rejection. And I think really God will give you what's really best for you. Keep on trying until you find that job. And if hindi ka naman masaya, ako personally, nakatataka sa isip ko yung laging sinasabi ng mom ko na as much as kaya mong tiisin. Kasi kahit sa environment, may mga conflicts, may inis kang katrabaho. Pero bakit the first reason why is you're doing your job is para may ma-provide ka sa family mo. Kasi dito ako, gustuin ko man siguro pursuing nursing, but may time siguro is hindi ko pa siya priority dahil I want my more time sa kids ko. So hindi ko pa talaga ma-prioritize na mag-go back to another study kasi sabi nila I can't do CAP since I don't have clinical experience and matagal-tagal na rin. So I think I need to do 2 or 3 more years. So yun nga. So I stay kung ano yung meron ako muna ngayon and just make the best out of it. And pero yun nga, 15 noon, masaya na ako. But who knows, in 1 or 2 years pala, mag-i-increase. So madaming mga unexpected things. So just watch out for unexpected things because I think those are blessings from God. Okay guys, if you like this video, please hit like and subscribe